Caitlin is one of those kids whose hearing loss was identified at newborn hearing screening.
At first she was diagnosed as moderate severe in her right and severe in her left.
There was no hearing loss in the family, but Caitlin's hearing loss was identified, and the parents knew at birth that she had a severe hearing loss.
We did months of testing, and it progressively got worse to the point where she tested profound in both ears by October.
So they came to see us when Caitlin was quite little, and the first thing we did was fit her with hearing aids, because every child deserves the chance to see whether hearing aids might work for them.
I pretty much knew if she got to the point where she was a candidate for a cochlear implant, we would definitely, without a doubt, do it.
A cochlear implant is a device that comes in two parts. The first part of it is implanted into the child or adult's head. This is the electrode, and you can see the little curlicue on the end of the electrode, which goes into the cochlea. And this is the magnet, which is underneath the skin. The child then has something that looks like a hearing aid that they wear behind their ear, and this magnet attaches to this. So the child is wearing this behind their ear, and they've got the implant inside their head.
Today we're going to be doing a cochlear implant on Caitlin Pritzker. We're in the New York Eye and Ear Infirmary. She has already had her right side implanted about 3 months ago, and now she's going to have her left ear implanted.
We've gone through this before. I am a little bit nervous, but we know what to expect now, and we're very confident in the people that we're dealing with.
Do we have a turn-on date for her?
Yes, we do. March 25th.
Yay! We're going to turn on 2 ears. You're going to get your second ear on March 25th. Pretty exciting.
99% of children with hearing loss can be helped with a cochlear implant. The 1% that cannot are children who have such a severe abnormality of the inner ear that you can't really get a cochlear implant into, or they don't have a nerve of hearing. So there's her implant. I already turned it off, and I'll come and get you as soon as we're done. Everything's going to be fine, okay?
See you in a little bit.
Yep.
It's day surgery. The surgery takes between 2 and 3 hours usually, and usually the child goes home the same day. The average cost is around $50,000, but it is almost always covered by insurance. This device, once implanted, stays there forever. We may change the speech processor, but the implant does not change. We usually make a small incision behind the ear and pull up the skin, and then they dig a well right behind the ear so that the top of the implant fits into the well, and the part with the electrode at the end of it is threaded into the cochlea. And then it is closed up, so this incision is sewn so that when it heals, there's just a tiny scar right behind the child's ear.
6 0 1 2 3.
So everything's fine. She's in recovery now. Okay, went very smooth, no problems. Okay. The best part of doing this type of surgery is the impact you make on their lives. Where before they would be in special education school, now with a cochlear implant, they usually end up in a regular school with regular children, normal speech, and they have the same abilities to be whatever they want in life.
Once it heals, the family returns to the Hearing and Learning Center, where we can teach them how to use the speech processor, what they need to do to take care of it, and we can program the speech processor so that it works for the particular child. In the beginning, we see them every couple of weeks because as their brain is getting exposed to sound for the first time, their ability to listen changes by the minute. And so we keep seeing kids every couple of weeks on an ongoing basis until until they sort of simmer down and we've gotten them so that they're hearing in a pretty steady state.
It's pretty easy. She does not try to take it off at all. It's held magnetically on. There's a magnet inside the internal piece, and the external piece has a magnet. She has the microphone on here. And the maintenance, the batteries are rechargeable. It's a body-worn processor at this age because the behind-the-ear units are very heavy, too bulky for the babies to wear.
As far as these kids are concerned, it sounds like it sounds to you and me. Now, the people who've had hearing losses, who had normal hearing and then lost hearing as they got older, say it doesn't sound exactly like it sounded in the old days, but it sounds very much well enough so they can understand speech, they can talk on the telephone, and they can live their lives hearing.
I would definitely advise you, especially to talk to other people who are in the same situation, or professionals who know who to guide you to. If you're unsure of anything, ask any question. No question is dumb. The internet is a great resource also.
I mean, there's almost no child that we can't say, this child can be anything he wants to be, because we have technology now that really opens up the world to children with hearing loss.
I have no doubt that she is going to be just like us, but that this, it certainly is not going to hold her back from anything, but if anything, maybe she'll become more proactive because of it, and get out there in the community or the world and let them know what she can do, and you know, being born deaf, and this is what she can do as an adult because she has, you know, 2 cochlear implants.
Thank you for watching Parents TV, Our Families, Our Lives.